Welcome, and thank you for joining us for the Community Food Bank of New Jersey's State of the Food Bank webinar. This session was originally recorded on April 22nd, 2025. Due to a technical issue, the introductions were not captured in the original recording. Before we switch over to that footage, I'd like to take a moment to introduce our speakers. In this video, you'll hear from Elizabeth McCarthy, President and CEO, and Adele LaTourette, Associate Vice President of Advocacy and Policy. Elizabeth and Adele will share updates on CFBNJ's work and the challenges we're facing. From the current state of food security in New Jersey to changes at the federal level that will impact our neighbors, to the progress we've made on our strategic plan, and most importantly, how your support continues to make our work possible. Additionally, you'll hear from Elizabeth and Adele respond to thoughtful questions submitted by viewers at the end of this webinar. We hope you enjoy the discussion. First, I'd like to introduce the President and CEO of the Community Food Bank of New Jersey, Elizabeth McCarthy. Elizabeth joined CFBNJ in the summer of 2023. She spent her career as a leader in shaping and implementing programs that address immediate critical needs, as well as providing the tools and support to affect long-term positive impacts on communities. Next, we have with us Adele LaTourette, who is our Associate Vice President of Policy and Advocacy. Adele joined CFBNJ in 2022. Previously, she was at Hunger Free New Jersey, where she served as director for over 40 years. She spent her career forging productive relationships with policymakers at all levels and championing transformative legislation that has expanded school breakfast, increased SNAP eligibility, and provided food assistance to more low-income seniors. We hope you enjoy the webinar. Thank you.
Really have to come up with many different solutions for different areas. So here you'll see the areas that we cover out of our headquarters in Hillside and then down in Egg Harbor Township. We do that through a network of partners, over 800 partners. And what do we mean by partners? It's pantries, it's soup kitchens, it's child feeding programs, which are like after school programs or summer programs. You can see on this map the distribution of where those partners are. And we also, though, and people understand through those, we serve about 90 million meals per year. So a huge amount of food. And that is something that we, is obviously our mission, our number one priority. But we also have some longer term programs. So a lot of what we're doing is trying to make it so that people don't have to go to food pantries anymore. So here you can see what we have in terms of the food distribution, our child nutrition programs, college pantries. One of the numbers that shocked me when I started here was that 1 in 3 college students in the state of New Jersey says that they've experienced food insecurity at some point in their college career, 1 in 3. And then senior delivery. So we have some home delivery programs. We work with senior centers, places to really make sure that we're getting meals to seniors who, as you know, can often be isolated or unable to go out to a pantry. And then we also do some crisis response. I was just at a Feeding America conference with food banks from across the country last week. We are very lucky that we don't have as much crisis response as, Texas, Florida, places that have sort of hurricanes and things all the time. But it is something that we're prepared to do for the entire East Coast to be able to help. But on the right side, you'll see some of the other things that we do, like workforce development, like enrolling people in SNAP or other benefits. Those are really important things because when someone comes to a food pantry, if we can meet with them, engage them, understand why they're there, and then really start to help them with services, we see that the length of time that they have to come to the pantry is dramatically decreased, and their quality of life is increased because they're getting help in other things and not just kind of the Band-Aid that the emergency food provides. So as I said, our mission is very clear. Nobody should go hungry. And we believe that should and usually is a bipartisan issue. So we are very clear that we want to make sure we're always working with both sides of the aisle to make sure people understand what an important issue this is in New Jersey. It kind of looks like a perfect storm coming our way. We have weathered storms before. We lived through the financial crisis, through COVID, and each time I think we've emerged stronger and actually more resilient. So what we've been doing is really trying to make sure that internally we are as efficient as possible, really doing everything we can to make sure that as many resources as possible are put toward food. So we've worked a lot on our distribution model. I mentioned those 800 partners. We have to deliver to a lot of those partners. So you can imagine the logistics of that. But we now have much better routing software, much better software in our warehouse that helps us really pack everything up much quicker and more efficiently. Our goal is to make sure that the vast majority of our resources are going directly into feeding people or long-term programs that can help. One thing we've been looking at with our delivery model is like possibly more of a hub and spoke model. And we're lucky, we have amazing partners that we think we can sort of, leverage some of their capacity and maybe only have to make one delivery to an area that has, 20 pantries, and then they'd be able to do more. So really just trying to figure out the best ways to kind of make sure that our model is as efficient as we can do. I'm going to talk a little bit about the current state, what we've seen so far on the federal level, and then turn it to Adele, who can go into much more detail on that. The current state. I think most people know on this call because you're supporters, but we get our food from several different areas, the food that we serve. And one big piece of that is the federal government. The others are donated food, whether it's from big retail stores or it's, neighborhood food drives. It all adds up together and there's donated food. And then the third is purchased food. And we do purchase a fair amount of food. Luckily, we have very good buying power because of our size. But the federal food is really a huge part of what we do. And last year, we were getting about 25 million pounds of food. We've seen a dramatic reduction in that. Right now, we're projecting to get more like 16 million pounds of food. So that's pretty significant. Now that could change. That's the thing about it, is it can be unpredictable. So we don't know for sure what that will look like, but we have to be ready to assume that we're going to have to purchase more food. One other definite thing that has happened is that there was a cut to the USDA budget. You probably read about that. That said, the $1 billion cut that was to the USDA. Well, about $26 million of that money went to the state of New Jersey. And just under 10 million was for FoodBank specifically to get out local produce and local produced food to our pantries. So about a $9 million hole that will be in the budget from produce and from locally produced foods. So that is something that we will have to work on the replacement for. And then the one thing that's looming is, we kind of hear about is a discussion of cuts to SNAP, which Adele will talk about in more detail. No definite proposal yet, so we are not here to say that, there's one specific thing that we know yet will be the cut, but it is something that is being talked about at the federal government level. So I'm going to have Adele talk a little bit about those things in more detail, and then I'll come back and again, keep any questions coming so we can have them, Megan can tell us and we can answer them. Thank you.
Hello, everybody. So I'm going to talk about SNAP and kind of what things are looking like at the federal level. Just so you know, SNAP used to be called food stamps. So just for reference, for those of us who've been around a while, that's what SNAP is, Supplemental Nutrition Assistance Program. You've probably been hearing about it. We serve in New Jersey about 850,000 people are on SNAP. That's about 9% of our population. We have a very effective, SNAP is extremely effective at reducing hunger. So over every year, SNAP lifts an average of about 100,000 people per year above the federal poverty line. So it's the first line of defense against hunger. You're going to see a slide coming up talking about how challenging it is. I mean, SNAP is a critical program. It's not necessarily the easiest program to access. There is a very complex application that people have to complete that I always liken to filling out your taxes without the assistance of an accountant most of the time. So you have income review. You have to be a U.S. citizen or you have to have legal residency. There are work requirements. You have to provide enormous amounts of verification. So it's a program that is really built to help people, but it really does work very hard to make sure that the people that it helps are in fact in need. We have in New Jersey one of the best SNAP programs in the country, and I'll tell you why. We have Speaker Coughlin has championed, obviously with the assistance of our governor, a minimum SNAP benefit of $95 a month. To compare that with a federal national average minimum benefit of $23 a month. We are the only state in the country that has that. For everybody. There are some states that have a minimum benefit of $100 for senior disabled. We have it for every household. I will say the majority of the households who receive that benefit are senior disabled, but it's just when I get onto calls with other advocates from across the country, they are always holding up our state as a model. So what are we looking at federally? What we're seeing now is that we have a framework. There is a framework in committee that calls for approximately $260 billion worth of cuts. In that committee, the primary target for those cuts will be SNAP. We do not know exactly what they'll be looking at this point. We have a sense, and just to give you a sense, we have an average benefit, or nationally, the average benefit for SNAP is about $6. One of the items up for discussion would be to reduce that so that the average household benefit will go down to $4. Elizabeth will tell you about, she did a SNAP challenge, and she can tell you about what it was like to try and live on that budget. There was a national organization that just did a call for try and live on a SNAP budget and see how that looks for you and your household.
Yeah, I did it for only 3 days. And I will tell you that it was really just so for two adults in their 50s, $6 a day each on food. The amount of, first of all, it's just hard to even get there, but the amount of thought and worry that goes into it, and really, and you have to be willing to, eat the same thing every day, eat things that aren't necessarily the most nutritious foods. It was very challenging, and I knew that the end was there in 3 days, but imagine if that was your life and really having to sort of constantly budget, worry about the cheapest possible thing you could get, and just sort of make sure that you're even getting enough, nutrients to get you through the day. I can't imagine if my son was still home, I couldn't have done it. But I think for a family, just thinking about having to do that much, to be able to feed your family, it's an incredible amount of work.
Yeah, and again, I want to circle back a little bit to the SNAP application. We do have, and you may have noticed it on the screen when we talked about all the programs that CFBNJ runs, we have a community connections team, and they help people complete those SNAP applications. And they facilitated more than 2,600 applications in 2024. And those applications ended up, people received over 1.2 million meals. And again, economic activity around SNAP is so important to look at, especially when you're looking at potential for cuts. So those 2,600 applications created more than 7 million in economic activity. What our grocers see, because SNAP is a benefit program that can only be used for groceries. It cannot be used for shampoo. It can't be used for toothpaste. It can't be used for diapers. It can't be used for period products. We see over $2 billion in economic activity at the retail level. So when we see cuts in the program, we will also see cuts in those transactions. It's something else to really look at when you look at community economic activity. It's estimated that for every dollar in SNAP, $1.80 is generated at the community level. So looking at the cuts, it's really important that people see exactly like the full breadth of kind of what the impact is going to be. What we do know is that any cut to SNAP is going to mean devastation at the food pantry level. Just to give you an idea of who some of the people that we serve are, we have a person in Atlantic City, I'm going to give you an example of. During the winter months, they lose a day of work each week. So with help from SNAP and with help from CFBNJ and our pantries, they're able to access nutritious food. SNAP supports people in a way that food pantries just are not able to do. It is an ongoing benefit program that people can transact at most of the stores in their neighborhoods. I will tell you on a completely different subject, but related, we have been working very hard to educate our gubernatorial candidates about the importance of community food bank, the importance of SNAP, the importance of federal feeding programs. I was on the train to Washington, the chamber train, and I managed to get an invitation to community food bank in the hands of every single gubernatorial candidate. So we know that education around SNAP, education around hunger, education around the work of community food bank has to be spread far and wide, state level and federal level, and we are working to do that. I'm going to pass it back to Elizabeth now to talk about how we're responding to the uncertainties at the federal level.
Yeah, and the one thing I'll add is, I mean, Adele and I were in DC a few weeks ago and just really making sure that we're talking to every single representative of New Jersey, the senators, the Congress people, just really making sure that people understand this issue on, again, both sides of the aisle. We do not believe that anybody wants children to be hungry, and just making sure that people understand these programs is really crucial. So one thing I have to say too that's been really amazing is in conversations with many of you, I've had conversations with donors, and just the amount of people who are saying to us, like, how can I help? And so actually had a donor that, when I talked about the USDA cut, gave us $500,000 to buy produce, which is incredible. And we're just so grateful for that generosity, but just it's that kind of thing that is going to keep us going through here. And so just, when people think about what they can do, that is huge, just an enormous amount of support. So here we are, our 50th anniversary year, and just kind of where do we go from here? And like I said, we're, yes, we're nervous about some of the storms to come, but we also know that we're a strong organization with strong support and that we are going to get through it. And we're not, in crisis mode. We are still sort of working on our strategic plan, making sure that we are still making ourselves a stronger organization. So there are some things we may have to do differently if things, depending on what happens with cuts, but there is nothing that is keeping us from all of our goals. So some of the goals that we had, one was new and better distribution. And so even before we were sort of faced with any of this, we're really working on making sure that our distribution model was more efficient. I've said many times, nobody would design a distribution model with 800 different community-based organizations to deliver to. And that is not a criticism of anyone that it was designed that way, because it was a grassroots movement, right? Pantries sort of come because people care about their community and want to start one. So now it's just sort of taking stock of that and kind of saying, well, how can we do this in a better way? Again, so that most of our resources are going directly to food. Second is healthy and nourishing food. And again, that, I've had people, as we've talked about, maybe having to cut our food budget or things, talk about, are we going away from that? We're absolutely not going away from making sure that it is healthy and nourishing food. Will we have to buy more proteins like peanut butter and beans and rice and less like salmon? Maybe we might be making these difficult choices. But, it's, I think, still making sure that there is nutritious food for kids, for families is absolutely a priority. So that is not something that we will walk away from. One of our strategic plan goals was to make sure that we were, using our voice, being an advocate. And clearly this is a time where we've all had to do that even more. And that's another area where we hope people will join with us. We have, we put out some advocacy information. If you want to, we have a newsletter people can sign up for. Getting phone calls to Congress people, et cetera, actually really matters. Like, I think when you're doing it, it can feel like, is this going to make a difference? But it does. They count and log every phone call to their office. They really do want to know what people are thinking about. So if you're someone who's willing to do that, we will be sharing information. Absolutely let your voices be heard. It's really, really important. And then one thing we had started probably about a year ago was just really a complete systems review of everything we're doing. So I showed the map that had those different partners on it. What we hadn't done in the past was really mapped all of those partners on the same map as food insecurity, and make sure that as much as possible, we are matching the resources to the areas with the highest food insecurity. So if we are ever in a position where we have to scale back some of the food that we're giving to pantries, it will not be an across-the-board cut. I have talked to food banks that have done that. When they've had to make cuts, they just cut every pantry by 10%. I do not think that's the right way to go about it. So we're making sure that we are using our food insecurity data to say, how do we get food to the areas that need it the most, that have the fewest resources? So when I look at Essex County with 21% of children food insecure, yeah, Essex County is not a place that we would want to scale back from getting food to children. So we're really much more sophisticated in the way that we can do that. We're also looking at different kinds of food, ways for people to access food. So for seniors, we already have some pantries that do home delivery, but are really trying to look at, is there a larger scale way to do some of that home delivery with existing infrastructure? We have a pilot in South Jersey with DoorDash, where we'll be doing some of the home delivery to people through DoorDash. And it's, they already have an infrastructure of people delivering. We're going to see if it's scalable. It's definitely a pilot, but see if it's a cost-effective way to get food to people who cannot come out to the pantries. We're looking at investing in some food lockers. Food lockers are kind of like if you've ever seen the Amazon lockers, same idea. Somebody can order food that they need. It gets put in the refrigerated locker so that they can come. We have people who are working, 2 jobs. The only time they can go to pick up food might be late at night or early in the morning. But this way they'll be able to go pick up the groceries when they can. So really just trying to look at all different ways of serving people and understanding that there's no one size fits all. So I mentioned earlier, we have Cumberland County, which is incredibly rural. That's why we have a mobile pantry down there that actually goes to people because there aren't places, right nearby versus a very densely populated place that just has very different needs. So really just trying to get much more sophisticated about that. The one thing that we're just really trying to make sure is that we're, communicating with our partners so that our pantries know when things may change, if we are going to be getting, less produce or less food, and making sure that they're aware and that they can, use their other resources in different places too. But just, communicating, making sure. But there's no doubt that this is going to have an impact on families in New Jersey. And so we're really just trying to make sure that we are, again, at our most efficient, being able to get food out to people in ways that we really are meeting as many needs as we possibly can. And that might mean for some period that, maybe some of our longer term programs aren't things that we're going to be able to do for as long. I hope not. I hope we're not in that position. But I think our number one priority will always be feeding people. And so that's, where all of your support has come in. We're really just so grateful. We have, we've seen from many people kind of an uptick at times once we have a conversation and talk about this. But we're a little worried that, even for donors, the market's been very volatile. Is that going to make people not feel like they can donate as much, which is totally understandable. But just want to be prepared for that as well. And luckily we have saved for a rainy day. We do have, several months of operating expenses that in case of a real crisis. So we're in good financial shape. But are, just want to make sure that we're sort of positioned very well no matter what happens on that federal level. So we'll get to questions in just a second, but people do ask us a lot, well, what can I do? Obviously I've mentioned, all of you are donors, so I can say give funds, but you already do. But that is the number one thing that we always obviously tell people, but giving your time. Volunteering, we really rely on our volunteers. So that's something that is great to do. You can sign up for volunteerships on our website, cfbnj.org. You can volunteer here. You can volunteer at one of our pantries. There's great opportunities in there. And then, as I said, advocacy. It's really, really important that elected officials hear from people in their districts that, what your feelings are about what's happening and about, what your priorities are. So those are all ways that people can help us and that all of you probably are already doing. But it's really, really, this is a time, again, I don't think we're at a crisis point. We're very well prepared. We've been planning, but we're just at a point that, resources are going to be stretched very thin. Okay, I think I'm going to take some questions from Megan.
All right. So I would say in the chat right now, I would say most of them are about SNAP. So we're just going to start with a few of those. So I'll ask 2 of them in tandem. So that way we can kind of answer them together. But one of them was $4 per person per day. So if you could speak a little bit more about your SNAP challenge and just confirm that. And then who is eligible for SNAP and why is it so important to keep?
Yeah, I mean, it's, SNAP is meant to be supplemental. So I understand, the $4 is not necessarily meant to be the whole thing, the whole amount that you spend. But thinking about, rent's gone up, wages have not kept pace. For some people, it is their only food budget. And so, yeah, I'm telling you that $6 a day, I like a challenge, so I did make it work, but it was hard to imagine trying to do that again, especially if you have kids at home. I mean, I didn't mind eating a peanut butter sandwich for 3 days for lunch, but not everybody wants to eat the same thing every day. And honestly, I couldn't buy fresh produce. And I'm a vegetarian. That's a huge part of what I usually eat. So I could not buy any fresh produce on my $6 a day. And so, yeah, trying to imagine doing it on $4 a day is really kind of incomprehensible. But Adele, you want to talk a little more about the qualifications?
Yeah, and I want to kind of circle back to what Elizabeth said in terms of SNAP being supplemental. We can say, and this has been true historically, is that at the last 2 months last 2 weeks of the month is really when pantries see a huge uptick in the number of people they serve. And it's because SNAP comes out beginning of the month. People buy what they can in terms of groceries, and then they have no choice but to go to their local food pantry. And yeah, the average benefit is now $6. I want to say it's $6.10 per person per day. If they go through with one of the cuts, and just remember, I just talked about one of the potential cuts, it would go down to $4 per person per day. People really, it's a wonderful program, but it is limited in terms of just the benefit amount. And again, I think we're looking at an array of cuts in different forms. So that will be the actual potential benefit cut, but there are other things that are being discussed. And in terms of who's eligible, it's really challenging to say. I think it's easier to say who's not eligible. So we can say that people who are undocumented are not eligible. People who have not been here at least 5 years and have U.S. residency are not eligible. Otherwise, as I said, it's a very complicated program. The form is generally a 12-page form, and it requires enormous verifications in terms of everything from what your housing costs are to what your childcare costs are to your utility costs. So it really it varies enormously in terms of who is actually able to get benefits. But in terms of who's eligible, generally, if you are a citizen, and again, income limited. I mean, I'm trying to think what the max income is. There are a series of deductions, so it's really impossible to say kind of what the income limits are. But
It's about, I think, 57,000 for
yeah,
a family of
for a
four
family of
today.
4. And that's today. So that's about, and I don't want to get into percentage of poverty because but they could bring that down as well. That's one of the proposals on the table, is to bring that gross income amount down. It gets very complicated. It gets very wonky. You can always email me if you want additional information, but that's a good kind of general overview in terms of who's eligible.
But the one group that I mentioned earlier, that's generally, it's not even that they're not eligible, but they're not usually able to access it as college students.
Yes.
Because of the work requirements. So if they're a full-time college student, that does not count towards the work hours. So you'd have to be working an almost full-time job plus be a full-time student in order to access it.
We did get, and again, I don't want to get wonky. I know I have a tendency to do that, but we did get in the state of New Jersey, kids who are in community colleges, their courses can count towards that 20-hour-a-week work requirement. We are working at the Community Food Bank in partnership with other agencies to see if we can get some of the 4-year college students eligible and make their courses count. So we focus on those things. Again, we look at what we can do here in terms of immediate distribution, but we also really work hard at, okay, but how can we expand SNAP? How can we make it so that these other programs, federal programs, are more accessible to the people that are being served at the food pantries?
So a few more, that was great, thank you. I do have a few more follow-up questions. So where does it go? Here we are most people receiving SNAP benefits working?
Yes, absolutely. 82% of our caseload in New Jersey has a working person in that group, in that family, in that household.
So going back to the potential cuts related to SNAP. So if the federal government cuts funding for SNAP, is it expected that in lieu of SNAP, that the feds, I'm assuming that's the federal government, will issue block grants to the states to assist the states in filling the void?
I don't think that's one of the proposals that I've heard. I mean, SNAP is an entitlement program, which technically means that if you are eligible, it could be any number of people. It's like a kind of an endless, it's there for people regardless. There's no limit on SNAP benefits budget. If they block granted it, which they actually did with Puerto Rico, it changes the program and it makes it so that, if you have X amount of money and you have something happens and you have more people who need the food, they won't be able to get it. Nobody's talking about block granting at this point. There is some discussion about the states paying a portion of the actual benefit amount. I can tell you some of our federal allies have run those numbers. And if the state of New Jersey is asked to pay even 5% of SNAP benefits, that would be $100 million. So yeah, there are some potentially devastating discussions happening.
So I have two somewhat related questions. So can you address how you are evaluating need, especially given the drop in uptake some places are experiencing due to some community members feeling unsafe on pantry lines? We also had someone did ask about ICE at how and if we are handling that or preparing for that at our pantry partners.
We have definitely heard anecdotally that some neighbors are not coming to pantries anymore for fear of ICE being there. We have not seen, statistically speaking, that huge a drop across the system, which does not mean that some pantries that happen to be in an area that have a lot of undocumented people aren't seeing that. They probably are. But as a system, we have not seen that big drop. What we've really tried to do is just make sure that people know what their rights are, the best way as possible to protect people so that they can come and get food. That's, again, things like the food lockers that I mentioned. That's one of the things we had in mind for that, so that people could pick food up at off hours. Definitely more home delivery, or sometimes, somebody will go and get food. They'll have their own card from the pantry, but also their neighbor's card, and are getting food for somebody else, which they can do as long as there's, that's documented that it's happening. So far we haven't seen that. We have only had ICE come to one pantry in our network that we know of. That's the only one we've heard about. That was back in January and was in Newark. Doesn't mean it couldn't happen, of course. And so just being very careful to make sure people understand how to, even like labeling the property, like which areas are private space, meaning you would need a judicial warrant to get in there versus a public space. Some of our pantries are outdoors, and that's tough. When the food distribution is outside, there is not much that they can do to protect people. So really just trying to work with each pantry individually when they say they have issues, and understanding what they're hearing from their neighbors and trying to come up with solutions that work for people. But I would not say that right now we've seen a huge decrease in need. If anything, some places are definitely seeing an uptick.
So changing gears again, so we have a question about, so we serve 11 of the 21 counties directly in New Jersey. How are the rest covered?
So we have two food banks that we work with that are our affiliates, Mercer Street Friends and Norwest Cap, and they cover the 4 counties on the western part of the state from Mercer up. So same idea, they work with different pantries, et cetera. And then the food bank for South Jersey works with the other pantries down in South Jersey on the western part of the state. But we all work very closely. I mean, this is a very collaborative relationship. And so, when one of the pantries had a power outage, we were sending refrigerated trucks. And when somebody needs something else, we're really we're trying to make it as seamless as possible. But every part of the state is covered.
Speaking of collaborating, does CFBNJ collaborate regionally with organizations in New York?
We do. Yes, we work with both City Harvest and Food Bank for New York City. We have worked with, as I said, we do emergency work. So, I think it was 2 years ago that there were those floods in Vermont in the summer. We were sending them food. We definitely work very collaboratively with people all throughout the region, and really sometimes throughout the country. I mean, when someone's going through something similar to what we are, we've, toured food banks in other parts of the country. You can always learn something from other places.
So one of the questions that we got in advance sort of asked about that optimized facilities piece of the strategic plan. So can you give an update on that progress?
Yes. So some of you, I'm sure, have been here to our warehouse in Hillside. It is not the most efficient building in the world. It is not laid out really to be a food bank. And so we've been thinking for a while that we were either going to try to move somewhere else or do some renovations here. We have been searching and searching for an appropriate place to go. And it's a tough thing to find a building that makes sense, or even a lot that makes sense in a location that's as convenient as where we are for volunteers, for staff, really sort of for our trucks coming and going and the routes that they have to go on. So our determination has been to stay here. And are now working with a firm to sort of look at what it would take to make us much more efficient. We need many more loading docks. If you've ever come for a volunteer shift, sometimes the longest part of the commute can be just our driveway trying to get into the parking lots because of the amount of trucks that have to wait to get into our loading docks. So we are looking at what is, the most cost efficient but effective way to renovate this building so that we can stay here for many, many years and just be able to do things a lot more efficiently. It certainly will mean more loading docks, possibly higher racking, so they could actually raise the roof is one possibility, because right now and much more cold storage. So one thing we're really short on is refrigeration and freezer space, because even 10 years ago, food banks mostly had shelf-stable foods. We didn't have the amount of produce and proteins and things that we do now. So that's something we definitely have to do. One of the first things we have to
do. So going back to how you can help. So we just got a great question in the chat. So I know, Elizabeth, you said that you were surprised about the number of college students who were food insecure. So we got a question: how could you best help college students who are food insecure, and what is most useful right now?
Great question. We actually have pantries on college campuses. 13, I think, but somebody can fact check me.
It's 19.
19. Thank you, Megan. So yeah, they always need help. So if you specifically want to work with the college pantries, you can, again, email one of us. We can connect you to the right place, but they're really wonderful. And they work with not only college students, but grad students, people who are new to this country in many cases, and some of the staff even at the area. So I've been to several of the college pantries, and they actually use the food lockers at Rutgers because many students they're busy during the day, they might be working, et cetera, and so they're picking up their food late at night, that kind of thing. But definitely they can always use help. So we would be happy to connect you to any of them.
All right. So we've talked a lot about what our plans are, our strategic plan, what we are, what our vision is. But we did have a question: is there any plan or vision to eliminate hunger/food scarcity in the region, eliminating the need for CFBNJ?
I mean, I think that's always the dream. Realistically, I think what you need to understand about food insecurity is that it takes on many different shapes. So yes, there are many people who are chronically food insecure. And I think that if we as a society, as a collective, wanted to try to work with that group, to invest more in job training, to invest more in the kinds of things that would help people get off the pantry line, I think we could make a real impact there, because we do have people who are working and are coming to our pantries only because they can't quite make it. As Adele said, maybe it's the last week of the month. They can't quite make it to the next paycheck. That is a somewhat intractable problem. But it's not one that I think we couldn't solve if we all worked on it together. But what I don't think could ever go away, there's always going to be emergencies. I mean, you often hear that statistic about how, 40% of Americans cannot withstand a $400 emergency. So there are always going to be people that are making it paycheck to paycheck, that are doing okay. But then there's a crisis. They might have a medical issue. Their car might break down. Like there could be something that happens. And realistically, I mean, I don't want to be a pessimist, but I guess I'd say that, it would be great to think that we could drastically reduce food insecurity, but that I think there's always going to be some sort of need for emergency food.
Yeah, and I just want to, historically, when I started doing this work and working in a food pantry, that's who we saw. We saw people whose electricity had been cut off, so they lost the food in their refrigerator, or some kind of literally an emergency. Now it's changed so much so that emergency food is really more people have to come every month. So yeah, that is kind of how this work began.
All right. So going back to food distribution. So has CFBNJ needed to pull back food distribution from our pantries?
We have, not drastically yet. And that's the good news. I mean, I think it's always a little bit of a pendulum because, as I said, some of our food sources are unpredictable. So the federal government food is unpredictable, and our donated food is to some degree unpredictable. So there have been some times where we have had to cut back. We're now at a pretty stable place. And like I said, if we have to do that, we're going to use much more data to decide kind of where to do it, and just make sure that we have a lot of communication with our pantries around it. I think it's unrealistic to think that we won't have to scale back at least somewhat. But I think we just want to be really thoughtful about what that looks like, how we can shift to lower cost items while maintaining nutritional value. And so, at the moment we're pretty stable, but it could certainly happen.
So I believe this was mostly covered in what you'd already said, but just to sort of bring it back to LFPA and those fresh foods, produces, proteins. With the loss of LFPA, excuse me, how are we going to ensure that we can still provide that fresh food and produce for those in need? We know that food is medicine. If you can just speak a little bit to that.
Yeah, I mean, that's so important to us, and food absolutely is medicine. We have a number of programs with sort of tailored meals for people with diabetes, with heart disease. If you go visit some of the pantries, you'll see that things are like color coded in certain places, like foods to encourage for somebody who might have certain health conditions. And actually, our food database has that for everything. So for everyone, like foods to choose rarely, foods to choose sometimes, foods to choose often. So we never say that you shouldn't have anything. Everyone should have a birthday cake or a cookie here and there, but just really trying to prioritize the nutrition. So that is a priority for us. So we will make sure. Will it be local? Probably not if we can't have that LFPA grant. Because it's just, when we can buy in such larger quantities from other parts of the country, we do just get much better rates for it. We love LFPA because I think, it gets you incredibly fresh food. I mean, there's times where things are picked in the morning and are in a food pantry in the afternoon. And it's a nice connection for the community too. I mean, I know the farmers really like that they're serving their own communities, but we are not walking away from getting produce and proteins. It just will be from different sources.
So shifting gears to tariffs. So are tariffs currently impacting CFBNJ? If not now, will they?
We have not yet seen the impact. What we're looking at is, we don't know is the answer. I'll give you a few scenarios that people are kind of talking about as possibilities. So last time when tariffs were in effect, there was a period where, because there was not an international market for some of our products in the US, food banks actually got more because the US government started buying it from the farmers and then giving it to food banks, which is great, except that the only problem with that is it's, again, very unpredictable, but also all of a sudden you get, a huge amount of one product. So like one food bank told me like they had just more milk than they ever could have used throughout their state. And it was Texas, that was a big state. We can all of a sudden get, 5 truckloads of grapes, which is great. People love them, but getting them out quickly, making sure, they don't have a long shelf life. So there is a possibility that, if there's tariffs and the US government decides to buy some things, that there might be a period where we have an uptick. We just don't know yet. Other ways that it could affect us is obviously just in the prices. So, in our purchasing, even though, we purchase domestically, but if there isn't as much of a international market, prices could go up domestically. That could be an issue for us. I think it's fair to say that it's unpredictable and we just don't know yet. But surely there will be an impact of some kind.
So I think we have time for just probably about one or two more questions. What can be done to stretch donated dollars in the budget? Is there a way to use different technology or work with other partners?
Yeah, I love that question, and is what we are trying to do all the time. So we have really been looking at our own budget, trying to cut, anything we possibly can that is not food related, to make sure that we are as efficient as possible. We have been looking at even going to some of our vendors and, trying to renegotiate some pricing. Really looking at which produce is, the most cost effective, which proteins are the most cost effective. It's absolutely a focus. And just our fiscal year starts July 1st. So as we kind of are going into our budgeting season right now, really just taking that all into account and sometimes having to make some tough choices. But I think, our mission is our mission, and that's absolutely the thing that has to be at the forefront. But yeah, even what I talked about with our food distribution, that can save money, because if we, again, are using more of a hub and spoke model or something else, it's a lot fewer trips. Once you have a lot fewer trips, it's a lot less gas, it's a lot less equipment, over time it can be labor costs, et cetera. So really looking at all of those things to try to figure out ways to stretch every dollar.
Last question. So since we have quite a number of people on, is there anything else that you'd like everybody to know before we say goodbye today?
First and foremost, how grateful we are. I mean, I really do, just the amount of people that have stepped forward and asked that very question, like, what can I do to help, is really incredible. I think our donors have just shown such a commitment to this cause that is unique, that is not always seen in nonprofits. And so we're very incredibly grateful for that. And then again, just, all the things we've mentioned before, volunteering, advocacy. Probably our biggest push right now is advocacy, honestly, because I think just having our voices heard, making sure people understand the impact of all of this on people. And, as we've mentioned it several times, but on people who are working, who are trying to raise their families. And this could be really devastating.
All right, anything to add, Dill?
Just again, no matter who your representative is, call. Tell them that this is an important issue for you. Tell them you're concerned about the cuts. Just make your voice heard. Your voice is critical at this time. Pick up the phone, call, write an email, let them know this is an issue about which you're really concerned.
Thank you both. This has been wonderful.
A couple times we said people can email us. Should we put our email addresses in the chat or something, or can we do that somehow?
There's no way. Oh, wait. No, I can only chat with.
Okay,
Oh, wait.
I'm gonna.
Yes,
I could just. Oh, okay, great. Megan, we'll put our email addresses in the chat.
Yes.
We're also not that hard to find.
We're really not.
Oh, yes. And don't forget to follow us on social media. We are so close to
Yes.
10,000 followers on Instagram.
Oh, yeah.
We're trying to do that for our 50th anniversary. We're also on TikTok and Twitter and Facebook
And LinkedIn.
and LinkedIn.
Yeah, that's actually a really big one because I think sharing stories, that kind of thing, it again sort of puts it in the public consciousness. People don't think of New Jersey as a state where there's a lot of food insecure people. I mean, it's a fairly wealthy state. You don't see it day to day. Every single community in New Jersey, there's not one zip code that does not have people that are food insecure.
Yep.
And I think it is just something that people don't think about. So absolutely, if you could follow us on social media and just sort of, share any information that you see there, that would be wonderful. Great. Thank you all so much for joining us. We really appreciate your time.
Thank you.
Have a wonderful day.